name is Dr. Joshua Taylor. I'm a general surgeon. I'd like to thank you for coming to see me today in consultation. I'd like to use this time using this video to explain the reason you're here to see me and answer some questions so that when you and I sit down, we can have a more in-depth conversation about what it is that is exactly going on with you or any questions or concerns that you might have. You've been sent to see me today to talk about colorectal cancer. So the first thing to talk about is what is colorectal cancer? Cancer in general is a particular type of cell within your body that has begun to grow abnormally. And so colorectal cancer is associated with the cells within the colon that have begun to grow and create a mass in your intestine. And this may have been identified through a scan or colonoscopy or other symptoms that you might have had. We know that there are some people who are more at risk for developing colon cancer, whether that be because family members have had it or other potential gene mutations. But we're also finding that people who are above the age of 50 are more at risk. And so this is something that screening can potentially pick up on and help prevent. So colorectal cancer often involves multiple treatments. You may or may not have met with a gastroenterologist, a medical oncologist, and now me, the surgeon. Oftentimes, all three of those doctors are involved in helping take care of your colorectal cancer. You may need chemotherapy, radiation, other stents or procedures to help you continue to move your bowels while you're undergoing the therapy for your colon cancer. And then ultimately, we want to get you to having surgery to remove the cancer. And that's where I come in. The goal of surgery is to cure you of cancer, to remove all of the cancer that's there, to check the lymph nodes, which is the first place that colon cancer often spreads, and to evaluate anywhere else in the abdomen that there might be some cancer that needs to be removed. Surgery for colorectal cancer is diverse, and I will talk a little bit in general terms, and then when you and I meet, we will talk more specifically about your colon or rectal cancer. But in general, the way that I perform this surgery is oftentimes minimally invasively with laparoscopic or robotic surgery. For you, that means there are multiple small incisions, and the biggest incision is usually between 3 and 4 inches where we remove that part of the colon that contained the cancer. Oftentimes after surgery, people are in the hospital 2 to 3 days to recover, and you're usually at home recovering for several weeks as well before you're ready to return to work. When we do colorectal cancer surgery, it's very important that we remove not only the colon or the rectum where the cancer is, but make sure that we've removed enough that there are clear margins, which means there's no cancer where we removed it. And we want to check the lymph nodes. And so we will remove the lymph nodes that are close to the colon, which is where the cancer may have spread to first. So the risks of colorectal cancer surgery are, number one, the colon and rectum has bacteria naturally in it, and so there's a risk of infection. Oftentimes before the surgery, we will have you undergo a bowel cleanse, both to empty out any stool in your colon as well as with antibiotics to decrease the number of bacteria in your colon. The colon and rectum have a very good blood supply, and so there's a risk of bleeding during the procedure. And so we have to be very careful to make sure that when we perform the surgery, we tie off those blood vessels and make sure that there's no ongoing evidence of bleeding. When we remove part of the colon and put it back together, that's called an anastomosis, and that anastomosis needs to heal. And so there's a risk that if it doesn't heal, that's something called a leak, and you may need other procedures, or being placed on antibiotics, or even surgery again to repair or fix this problem. The colon is associated with other parts of your intestine, the small intestine, as well as other organs such as the kidneys, the stomach, and the spleen. And when we're performing the surgery, we have to be very careful not to damage those. In addition, especially for rectal cancer surgery, there are very important nerves in the area that go into your pelvis, and so we have to be very careful not to damage those nerves as well. So one of the questions that often comes up when we talk about colon and rectal cancer surgery is, will I need a bag? Oftentimes this depends on exactly where your cancer is and the type of surgery we need to perform. That can either be something called a colostomy or an ileostomy. And you and I will speak in depth about why you might need that. Reasons could include if you've already received chemotherapy or radiation before your surgery, we may need to give more time for things to heal. Or there may be specific things such as it creating a blockage or other specifics that would require for you to need an ostomy. I'll be in momentarily to talk with you and be more specific about what it is that's going on with you and how I think surgery might help. If you have any questions, feel free to write them down. You can re-watch this video and you and I will go through them when we meet.